to remember while you're sick, and that is to monitor your blood sugars. Some illnesses raise them, some lower them, and everybody responds differently. When your body gets sick, it releases stress hormones, which can cause your liver to release glucose into the bloodstream, which raises blood sugar. This happens because your body is trying to make sure that you will have enough energy while you're sick. But if you have type 1 diabetes, your body doesn't have any way of naturally controlling your blood sugars. When this happens, it is important to keep your blood sugar under control by dosing with insulin and correcting. It is also important to test for ketones regularly while you're sick. If your body isn't getting enough glucose into the cell, it may begin using fats for energy, generating ketones. If you have high levels of ketones for several hours or more, call your doctor. However, some sicknesses cause the opposite problem. If you are nauseous and vomiting and aren't able to eat anything, but still taking the same amount of insulin, then your blood sugars can go low. In this case, you would want to reduce the amount of insulin that you are taking, or try to eat a little bit of simple carbohydrates to help raise your blood sugar. However, nausea and vomiting are also symptoms of ketoacidosis, so make sure that you are carefully monitoring your blood sugars and ketones while sick. Remember, always consult your doctor before making large changes to your care plan. The best thing to do is to monitor closely, make small adjustments as necessary, and talk with your doctor about larger changes to your care plan. Aside from the illness itself, there are also some medications that may raise or lower blood sugars even more. Ask your doctor or pharmacist about the effects that medications will have on blood sugars before taking them. Finally, the best thing that you can do is what everybody should be doing. Keep hydrated and get some rest. These are the best ways to help your body fight your sickness and start feeling better soon. If things are getting worse, call your doctor, especially if you have repeated episodes of vomiting and/or diarrhea in the same day, if large amounts of ketones remain in your urine for several hours, if you have any questions or concerns about adjusting your insulin dosage. Always remember, call your doctor anytime you have a question. Don't just guess about what to do. They will know best about how to make sure you stay safe while sick. Although we've covered a lot of information here, the most important thing to remember is to monitor your blood sugars closely. Everybody responds differently, and your blood sugars will most likely be different than from when you're healthy. The best way that you can make sure that you stay safe while sick is to monitor your blood sugars and treat them as your doctor instructs.